My name is Sofikul Islam, and today I would like to provide my response relating to application of acupressure in a clinical setting in 5 easy steps. First of all, I would like to explain acupressure and East Asian medicine concepts. When introducing acupressure to a patient or caregiver, I would use clear, simple language to make the concepts accessible. That is, acupressure is a gentle hands on technique based on the principles of East Asian medicine. It involves applying firm but gentle pressure to specific points on the body to promote healing and balance. According to EAM, our body has energy pathways called meridians. These meridians help life energy or chi flow smoothly. Sometimes, due to stress, illness, or injury, this flow is restricted. Acupressure helps to restore balance and support its natural healing process. I would highlight any research based benefits relevant to the patient's condition like nausea, pain, and emphasize that it is non-invasive as well as very safe. Second, step 2, I would obtain consent from the patient, provide a verbal explanation of what the session will provide, the duration, points of contact, and the expected session. I would also address any questions or concerns of the patient. I would ensure informed consent is obtained by asking, do you feel comfortable with me using this acupressure to support your care today? For patient who cannot give full consent, I would take the consent from the legal caregiver or healthcare proxy. Now, for the step 3, I would adapt approach for specific clinical condition based on lesson. Is acupressure safe for everyone? I would make the adjustments. If patient is pregnant, I would avoid certain acupressure points which are known to stimulate uterine contractions or affect hormonal pathways. They are LI4, HEGU, SP6, and BL60. I would use safe pregnancy appropriate points for nausea or relaxation as well as morning sickness. Now, for patients with low platelets or bleeding disorder, I would use lighter pressure, avoid areas which are prone to bleeding, and I would monitor closely for any skin changes and avoid repeated stimulation of the same area. For patients with history of trauma, I would provide special care, take a trauma-informed approach, ask permission to allow the patient full control for pause and stop. Now, step 4, I would evaluate and document effectively. To assess and document the impact of acupressure, I will use a simple 0 to 10 pain or stress scale before and after the session to track the changes. I shall note improvements in sleep, appetite, mood disorder, physical symptoms like reduced nausea, and also tension. My documentation shall include the points used, duration of pressure, patient's response, any side effects, discomfort, and follow-up recommendation. Now, the step 5, the scope and policy considerations, which is the most important. Two key factors are scope and practice. I shall ensure that it is safe and within my licensed professional scope, and that I have received the formal training in the Eastern Asian medicine as well as therapeutic touch. Now, the last, which is the institutional policy, I shall follow the guidelines of integrated therapies, chart documentation, adhere to the protocols, as well as maintain safety and transparency. Thank you.